February is National Heart Month. It's a time to bring attention to the importance of staying heart healthy. This morning, tips on doing just that to help prevent heart disease.
Here with these potentially life-saving tips is a non-invasive cardiologist, Dr. Jay Shu of WellHealth Cardiology. It's great having you.
Great to see you.
Thank you. I'm excited to be here.
February is a Heart Month, and why is February Heart Month, and what is Heart Month?
February has been designated as National Heart Month and has been since 1964, and it's really to bring attention to the problems with heart disease. So it's a good time early in the year to see how people can make their lives healthier and focus on their heart.
Is heart disease a huge problem here in the U.S.?
It is. Unfortunately, it's the #1 killer for Americans and even people across the world. So it's important to have this recognized early on.
I was doing a little research for this and I found that 1 in 4 die from heart disease.
It's a very common thing.
Wow.
So
incredible.
But not only that, high blood pressure also is a very important part of risk for death for heart attacks as well as strokes. So it's important to look at all the risk factors like cholesterol problems, blood pressure, smoking, even diabetes, and your family history.
If you've never been tested for high blood pressure, do you know you have it?
No, it's one of the silent killers, and so it's important to have it checked on a regular basis. And generally speaking, if you're younger than the age of 40, having your blood pressure checked at least once every 2 years is important. And I do remind people that we don't go to the doctors as often as we should.
No.
So if you stop by the local pharmacy or the local fire station, just have it checked at that time.
The fire station will do it for you?
Yes, they're very good
nice.
with that.
That's pretty awesome.
I didn't know that.
There we
That's
go.
a good tip.
You go to the fire station rather than them coming to you.
Exactly.
That's a pretty good thing. So if you're diagnosed with high blood pressure, does that mean like you're done? You have high blood pressure, there's no fixing it, or is there something you can do?
Well, the first thing we'd like to recommend is if you're diagnosed with high blood pressure at the doctor's office, checking your blood pressure outside the doctor's office is important.
You might have white coat syndrome.
Exactly. We're all a little bit nervous when we go to the doctor's office.
Yeah.
And also checking it properly at home or at the store is good. Making sure you're using an arm cuff and making sure that you rest for 3 minutes prior to checking your blood pressure. That's
Really?
important as well.
See, I'd never known about the resting portion.
Yes, if you're just walking to get your blood pressure cuff, the walking can raise your blood pressure. But once, going back to your original question, once the diagnosis of high blood pressure is made, it's not a permanent diagnosis. It just means that you're prone to it. So if you make some changes to your lifestyle, such as exercise, changing your diet, lower sodium intake, smoking cessation, and so on, those can all promote lower blood pressure in the long run. So it may not be a long-term diagnosis.
What are things that put you at risk for high blood pressure?
That's a very common issue that people have as we get older because we become less active. And so people who have a sedentary lifestyle, that really does impact their blood pressure problems. Obesity is also another big one, and looking at your diet as well. If it's high in sodium, even sodium in things that we don't really think about, such as sodas and breads using a lot of salt, they all can contribute to high blood pressure as well.
I'm giving up bread for Lent then. That's what I'm doing.
There it is.
That's my goal.
What's a good blood pressure reading? Does it change by your age, or is it just always 120 over 80?
No, it's the limit would be 140 over 90 traditionally.
Okay.
And the last set of guidelines that came out a few years ago has relaxed that for people over the age of 60. So if you're over the age of 60, then the top number can now be 150, whereas the bottom number is still at the 90 mark.
Gotcha.
Now, you mentioned if you're about 40 or younger, you should go every 2 years to get your blood pressure checked out. Let's say you have high blood pressure. What can we do to lower it? Do you take medicine?
Medications are one of the more common ways of treating it, and they work very, very quickly. But there are other ways that people can do at home, and these are very important things as well. If you're a smoker, the most important thing is to stop smoking because that's a huge factor in promoting high blood pressure. The other things would be making sure your diet is low in sodium, less than 2 grams per day, as well as...
Less than 2 grams per day?
Yes.
Oh my goodness. And you see some of these nutrition labels.
Yes.
It's everywhere.
And if you go to McDonald's or a fast food restaurant, you look at the sodium load in a value meal, you'd be very surprised. It could comprise your whole day's worth of sodium in that one meal.
Pretty incredible. Just out of curiosity, what do the two numbers mean on a blood pressure reading?
Top number is related to the blood the pressure in the blood as the blood and the heart pumps blood through the artery.
Okay.
And so it pushes out against the walls of the artery, and that's the top number. As the heart relaxes and it's taking a little break in its pumping function, the bottom number is where the blood vessel relaxes.
I see.
And that's the bottom number.
So what's the biggest and what's the smallest, essentially?
Exactly.
Gotcha.
And if you're taking these steps, as you mentioned, to turn your life around, be more heart healthy, you can live a very long and healthy lifestyle, even if you've had problems in the past.
Theoretically, yes. So it's never too late to treat high blood pressure, but certainly the longer blood pressure problems are untreated and unrecognized, the higher the risk of death or having a complication if you ever develop a stroke or heart attack.
Well, it's very important advice, and hopefully that inspires some people out there to come in and see you.
Surely.
Yeah.
Before they have to come in and see you.
Yeah.
It's great having you.
Thank you so much.
Thank you.
Take control of your heart health. February is Heart Month. WellHealth Cardiology has the professional staff and experience to help you if you're at risk. For more information, just head to the website or call the number listed. They're also on Facebook and Twitter.